and this is the final class for gynae. Today we will finish the gynae syllabus and all those topics which I have taught, those are the most important. यही सबसे important है, ये करना है पहले, उसके बाद जो माइनर टॉपिक्स आते हैं वो अपने अपने टेक्स्ट बुक जो भी फॉलो करते हो वो फॉलो करके उसको कवर कर लेना। और माइनर टॉपिक्स जो हमें एमसीक्यू सॉल्व करने के टाइम जो नए नए नाम मिलेंगे वो सब सिर्फ पढ़ना है, बाकी सब कुछ नहीं पढ़ना है, सिर्फ यही पढ़ना है जो मैंने पढ़ा है, यही सबसे इम्पोर्टेंट टॉपिक्स हैं। So today we will start with infertility. So infertility, what is infertility? It is the failure of a couple of reproductive age to conceive within 1 or more years of regular unprotected coitus. ठीक है, the couple should be in the reproductive age group and even after trying for more than 1 year of unprotected coitus, they are failing to conceive. They are not able to become the parents even after trying for 1 year. ठीक है, 1 साल तक कोशिश कर रहे हैं and they are doing regular unprotected. There should not be any contraceptive measure. कोई condom या OCP they have not used for 1 year and still they are not able to become parents. So why only 1 year? Why not 6 months? Why not more than 1 year? So this is related on one factor and that is known as fecundability. What is fecundability? It is the probability of conceiving in one menstrual cycle. एक menstrual cycle में कितने percentage couples, अगर वो 100 couple है तो 100 में से how many couples can conceive in one menstrual cycle, that is known as fecundability. So for example, अगर मैं बोलती हूँ there are 100 apparently healthy couples, ठीक है, for example I am taking there are 100 couples and they are apparently healthy, means they are not suffering from any diseases. So after one menstrual cycle, what will be the probability at the end of 1 month of uninterrupted coitus or unprotected coitus they have done for 1 month? और 1 month के बाद क्या होगा? Only 20 couples will conceive. Only 20 couples will conceive. So average क्या हुआ? What is average? It is 20%. So the average fecundability to get pregnant in one menstrual cycle is 20% and it can be maximum up to 35%. ठीक है, तो 20 to 35% is the probability of getting pregnant in one menstrual cycle. और ये कैसे decide होता है? How it is decided? Based upon the 100 apparently healthy couples. Then at the end of 6 months, if there are 100 couples and at the end of 6 months, how many couples will conceive? At the end of 6 months, this will go up to 75%. Okay, 75% or you can say 70 to 75% of the couples will conceive at the end of 6 months. And at the end of 1 year, it is around 85 to 90%, that is maximum. तो मतलब maximum couple is 100 में से maximum 85 to 90% of the couple will conceive in 1 year. That is why in the definition we have taken 1 year. Okay. So at the end of 1 year, how many couples out of these 100 will conceive? 85 to 90% would have conceived, and this is the concept of fecundability. And still those who are not able to conceive after 1 year, how many I have said? 85 to 90% will conceive. So for remaining 10 to 15%, we will start the evaluation for infertility. We will do different investigation. बहुत सारे investigation करके देखेंगे कि अभी भी 1 साल के बाद भी why they are not able to become parents. So for those 10 to 15%, we will start doing investigation, and that is why we have taken the deadline of 1 year because एक साल में क्या होता है, maximum couples will conceive, 85 to 90% of the couples will conceive in 1 year if they do regular unprotected coitus for 1 year. I hope this is clear. Then there are some couples where we have to do earlier evaluation for infertility, means हमें 6 months में, for 6 months we have to start doing the evaluation for infertility. So who are those special couples? कौन से couple के लिए हमको 6 महीने में ही infertility के लिए evaluate करना start कर देना चाहिए? So in the couple where there is history of prior infertility, means पहले भी उसमें infertility की एक problem आई थी. Second is presence of obvious risk factors, like the patient is suffering from PCOS or she is having irregular menstrual cycles. So in such case, we have to start the evaluation within 6 months, or we have to start evaluating for infertility after 6 months of unprotected coitus. And in the couple where the woman is in the age group of more than 35 years, elderly females who has not yet conceived और who is more than 35 years age, उसमें भी हमें 6 महीने के बाद ही infertility के लिए उसको evaluate कर देना चाहिए. So these are the cases where earlier evaluation for infertility is required. Then types of infertility. So you all know there are two types of infertility: primary infertility and secondary infertility. What is primary? In which the female has never been pregnant, means in her whole lifetime she has not been pregnant once, एक बार भी कभी भी pregnant नहीं हुई. And secondary infertility means infertility in a woman who has had one or more previous pregnancy. एक या एक से ज्यादा पहले वो प्रेग्नेंट हो चुकी है and now for the subsequent time she is not able to get pregnant. And ये जो प्रेगनेंसीज है, इसका मतलब ये नहीं है कि उसको लाइव इशू पैदा हुआ है. द चाइल्ड कैन बी इधर लाइव और डेड. व्हाट वी हैव टू कंसीडर, वेदर शी हैज गॉट प्रेग्नेंट और नॉट. दैट इज सेकेंडरी इनफर्टिलिटी. अगर बच्चा पेट में ही अबॉर्ट हो गया, दैट विल नॉट बी रिगार्डेड एज प्राइमरी इनफर्टिलिटी. उसको भी हम सेकेंडरी इनफर्टिलिटी में ही काउंट करेंगे. सो a woman who has had one or more previous pregnancy, पहले एक या एक से ज्यादा बार वो प्रेग्नेंट हो चुकी है and now she is trying for the second time, अब वो प्रेग्नेंट नहीं हो पा रही. Now broad classifications of infertility for the causes of infertility. Male factors account for 30 to 40%, female factors account for 40 to 50%, and combined causes account for 10%, and there are certain unexplained causes. और unexplained infertility के कितने परसेंटेज होते हैं? 10% cases. Then causes of female infertility. So first is ovulatory dysfunction, which accounts for 30 to 40% cases. ट्यूबल डिजीज मीन्स कोई भी फेलोपियन ट्यूब में प्रॉब्लम है, सो ऐसा कितने केसेस में होगा? 25 to 35% केसेस. देन यूटराइन फैक्टर्स, जैसे कि कंजेनाइटल डिफेक्ट थे यूट्रस के, सेप्टेट यूट्रस, आर्क्वेट यूट्रस, सो ऑल सच कॉजेस दे अकाउंट फॉर 10% केसेस. देन सर्वाइकल फैक्टर्स, दिस इज 5%, एंड endometriosis, pelvic endometriosis, it accounts for 1 to 10% of the cases. Now this is the image for the causes of female infertility. So first सबसे ज्यादा हमने देखा था ओवेरियन फैक्टर्स. इसमें हमारा PCOS, एनोवुलेशन या कॉर्पस लुटियम इनसफिशिएंसी, प्रीमेच्योर ओवेरियन फेलियर, रेजिस्टेंट ओवेरियन सिंड्रोम, दिस विल इंक्लूड दिस टाइप ऑफ कॉजेस. देन ट्यूबल कॉजेस में आते हैं, कोई भी ट्यूब में इंफेक्शन हो गया या पेल्विक एंडोमेट्रियोसिस हो गया. Then tubal blockage, that is another cause. देन जेनाइटल ट्यूबरकुलोसिस, मोस्ट कॉमन साइट क्या है फॉर द जेनाइटल ट्यूबरकुलोसिस?
fallopian tube.
Which part of the fallopian tube? Very good. Fallopian tube is correct.
एम्बुला.
Very good. Ampulla. So उस केस में भी infertility हो सकती है. And the most common symptom of your genital tuberculosis is infertility लेके ही patient हमारे पास आता है. Then your uterine factors में endometriosis, fibroid, uterine synecdoche, जिसको एशरमैन सिंड्रोम भी बोलते हैं, congenital malformation, ये सब causes हो सकते हैं. Pelvic factors include your peritoneal and tubal adhesions, endometriosis, dysovulatory causes, PCOS and elderly women, ये भी pelvic factors में आएगा. Cervical factors में ineffective sperm penetration और chronic cervicitis, chronic inflammation of cervix and presence of anti-sperm antibody in the cervix. This is also an important cause for infertility. Now, in ovarian causes, जो ovarian cause है for infertility, what is the most common cause for ovarian, which is responsible for infertility? अगर ovarian cause की बात करें तो most common cause is anovulation. So there is anovulatory cycles. Menstrual bleeding तो हो रही है, but there is no ovulation. So anovulatory menstruation. This is the most common cause for infertility, and this is the most common easily reversible and treatable cause. So this is very very important. Most common reversible या treatable cause क्या है female infertility का? Anovulation. और anovulation में या ovulatory causes में what is the treatment for? Modern medicine क्या करते हैं? ये क्वेश्चन कभी कभी आता है, so that is why I am telling. So what are the treatment they are giving? First of all, they will induce the ovulation. So ovulation induction. OI means ovulation induction. For 3 to 6 cycles they will give ovulation induction. उसके बाद भी फिर भी if the female is not getting pregnant, फिर भी pregnant नहीं हो रही है, what they will do? Ovulation induction plus intrauterine insemination. Intrauterine IU insemination means they will deposit the sperm in the uterine cavity. Uterine cavity में semen लेके husband का they will put it inside the uterine cavity and they will do this for 3 to 6 cycles. फिर भी अगर नहीं हो रही है pregnant तो what they will do? In vitro fertilization, that is nothing but the test tube baby. So this is the course of treatment given as per modern medicine. ये क्वेश्चन कभी कभी आता है इसलिए I am telling you. Then tubal causes. Tubal causes में important cause include genital tuberculosis, PID and endometriosis of the fallopian tubes. Tubal causes में main factor or main function of tube is fertilization. Tubes में क्या होता है? Fertilization. कौन से part में होगा fertilization? In which part of the fallopian tube fertilization will occur?
Ampulla.
Yes, very good. So यहाँ पे क्या होगा? क्योंकि as the fallopian tube is concerned with fertilization, so ovulation induction करने से कुछ नहीं होगा, ठीक है? Even if you induce ovulation, the cause is lying in the tube. क्योंकि cause कहाँ पे है? ट्यूब में प्रॉब्लम है, तो ओव्यूलेशन इंडक्शन करके कुछ नहीं होगा. इंट्रायूटराइन इंसेमिनेशन करके भी कुछ नहीं होगा. सो यहाँ पे डायरेक्ट जो ट्रीटमेंट होता है एज फार एज modern medicine is concerned, they directly give in vitro fertilization because your tubes are concerned with fertilization. ट्यूब में क्या होगा? fertilization, इसलिए direct in vitro fertilization is the main treatment. Then next is your cervical factor. So cervical stenosis हो गया, that cervix has become इतने साइज की थी वो नैरो हो गई, सर्वाइकल स्टेनोसिस. या फिर सर्वाइकल म्यूकस एबनॉर्मलिटी, सर्विक्स में जो म्यूकस है दैट हैज बिकम वेरी थिक और देयर इज प्रेजेंस ऑफ एंटीबॉडीज अगेंस्ट स्पर्म. सर्विक्स में जो म्यूकस है उसके अंदर स्पर्म के अगेंस्ट एंटीबॉडीज है एंड दे आर किलिंग ऑल द स्पर्म्स. So cervical factors में what they are giving treatment, they are doing ovulation induction plus intrauterine insemination side by side. ठीक है, यहाँ पे सर्विक्स को ही बाईपास कर दिया. ठीक है, ये दोनों ट्रीटमेंट क्यों दे रहे हैं? क्योंकि सर्विक्स के ऊपर यूट्रस है. सो वी आर बाईपासिंग द सर्विक्स and they are doing ovulation induction and intrauterine insemination. Then come to the uterine causes. So uterine causes में you have to find out the defect. कहाँ पे problem है? First is the congenital defect which I have already dealt with in previous classes. Previous class में मैंने सारे congenital uterine defects पढ़ाए हैं. So just revise them. Congenital defects जिसमें हमारे आते हैं uterine और Mullerian anomalies. And acquired defects में आएंगे endometriosis and fibroids. Then what are the investigations for female infertility? First, you have to do the diagnosis of ovulation, whether there is ovulation going on or not. Ovulation हो रही है या नहीं, सबसे पहले ये पता लगाना. First are the indirect investigation. Indirect investigation में first is Mittel-Schmerz syndrome. What is Mittel-Schmerz syndrome?
Mid-cycle ovulatory pain.
Very good, very good. Mid-cycle ovulatory pain. At around 14th day जब ovulation होती है तो there is pain and sometimes there is spotting also. So this is an indirect evidence that ovulation is happening. That is known as Mittel-Schmerz syndrome. Second evidence is BBT, basal body temperature. Basal body temperature क्या होता है? Around ovulation it rises by 0.5 और 1 डिग्री फ़ारेनहाइट. ठीक है, जैसे ही ओव्यूलेशन हो जाएगी तो टेम्परेचर 0.5 से 1 डिग्री फ़ारेनहाइट इंक्रीज हो जाता है. व्हाई इट इज इंक्रीजिंग? इट इज इंक्रीजिंग ड्यू टू प्रोजेस्टेरॉन. सो रिमेंबर the temperature is rising after ovulation due to progesterone, not estrogen. This is very important. Then third is you have to do cervical mucus study. Cervical mucus study में what you have to do? Spin-Burkitt test and Fern test. So what is Spin-Burkitt test?
Stretching of cervical mucus.
Very good. Elasticity of cervical mucus. We are looking for the elasticity of the cervical mucus जो कि बिफोर ओव्यूलेशन अलग होती है and after ovulation it changes. So the elasticity of the cervical mucus changes before ovulation and after ovulation. Before ovulation the elasticity is more than 10 centimeter. Okay, and why there is elasticity in this mucus before ovulation? कौन से हार्मोन की वजह से है? It is due to which hormone?
Estrogen.
Very good, estrogen.
Estrogen.
The elasticity of the cervical mucus before ovulation is maintained because of estrogen and after ovulation estrogen कम हो जाता है इसलिए the elasticity decreases from less than 10 centimeter. Then Fern test क्या होता है? What is Fern test? This is the Fern pattern seen in the cervical mucus. We will put the cervical mucus over the glass slide and we will see a Fern pattern. और ये Fern pattern कब होगा? When will be the Fern pattern seen? Before ovulation या after?
Before.
After ovulation.
Very good, Pohor. It is before ovulation. Very good. Before ovulation, you will observe a Fern pattern in the cervical mucus. और ये Fern pattern भी कौन से हार्मोन की वजह से? It is due to which hormone?
Estrogen.
Very good, estrogen. And it appears on day 8th. ठीक है, ये भी एक चीज याद रख लो. The Fern pattern in the cervical mucus appears at around 8th day of the menstrual cycle and it is due to estrogen. Estrogen की वजह से होता है. And Fern pattern is lost after ovulation. At around which day it is lost? Day 22 to day 23. Yes, very good. 22 से 23 day में this fern pattern is lost. Then next is you have to do vaginal cytology. Vagina में 3 type के cells होते हैं. What are those cells?
Basal cell,
Very
intermediate
good.
cell, superficial.
Very good. Very good. Basal cells or parabasal cells, intermediate cell and superficial cells. You have to do the study of these cells, and the study of these cells is known as MI study or maturation index. ये भी मैंने previous class में पढ़ा दिया. So just go and revise. Then next is hormonal estimation. You have to do the hormonal estimation, and this is the best and easiest test for ovulation. ये चीज भी याद रखना है. Important question. The best and easiest test for diagnosis of ovulation is hormonal estimation. कौन सा हार्मोन चेक करना है हमें? प्रोजेस्टेरॉन हार्मोन. At which time? At mid luteal time. Mid luteal phase में you have to check the progesterone, and progesterone is at peak at that time. Progesterone mid luteal phase में सबसे ज्यादा होता है. That is at around day 21 और 22 पे. ठीक है, कितना होगा? More than 10 नैनोग्राम होता है. और अगर ये होगा तो that means ovulation has occurred. ठीक है, तो we have to check for the progesterone level. कब चेक करना है? एट द मिड लूटियल फेज. कब होगा मिड लूटियल फेज? एट अराउंड डे 21 एंड डे 22 ऑफ द साइकिल. व्हाट विल बी द लेवल ऑफ प्रोजेस्टेरॉन एट दैट टाइम? मोर देन 10 नैनोग्राम पर ml. अगर ऐसा हो जाता है, इफ यू फाइंड दीज लेवल्स, दैट मीन्स ओव्यूलेशन हैज अकर्ड, and this is the best and easiest test for ovulation. Next is endometrial biopsy. When you have to do endometrial biopsy? कब करना है? 21 to 23rd day के बीच में you have to perform it. What you will see? You will see these subnuclear vacuolations. ठीक है, these are known as subnuclear vacuolation, and this is the earliest evidence, or you can say first sign of ovulation on endometrial biopsy. So another important question, first sign of ovulation on endometrial biopsy or earliest evidence of ovulation on endometrial biopsy is subnuclear vacuolation. And this is seen in which phase? Early proliferative phase, or you can say after mid luteal phase or early proliferative phase. Then direct evidence of ovulation, it is laparoscopy. Just cut open the abdomen, abdomen को काटो, खोल के ovaries में देखो ovulation हुआ या नहीं. So this is the direct evidence. And conclusive, most specific evidence is pregnancy. ये question भी आता है. Then tubal factors, ये हो गए ovarian factors. Tubal factors में Rubin's test, but it is obsolete, अब इसको नहीं करते हैं. Then HSG, hysterosalpingography. इससे क्या होगा? You will know the side and site of blockage. Right fallopian tube block है या left, तो you will know the side and site also. Whether the blockage is in the ampulla or it is in the interstitial part. So you will also know the site of the blockage. Then laparoscopic examination is the gold standard for diagnosing the tubal factors. What else you can do? Sonohysterosalpingography or salpingoscopy. These are the other investigations you can do for tubal factors. यहाँ से क्या याद रखना है? This you have to remember. Laparoscopy, this is the gold standard. And if you want to know the side and site of blockage, then you have to do HSG, hysterosalpingography. नेक्स्ट इज सर्वाइकल फैक्टर्स. इसमें क्या करना है? पोस्ट क्वाइटल टेस्ट, और इट इज ऑल्सो नोन एज सिम्स हनर टेस्ट. इसमें क्या होगा? द म्यूकस इज स्टडीड आफ्टर द इंटरकोर्स. द कपल विल परफॉर्म द सेक्सुअल इंटरकोर्स, देन यू हैव टू कलेक्ट द म्यूकस फ्रॉम द सर्विक्स. एंड उसमें क्या देखेंगे? यू हैव टू डिटेक्ट द एंटी स्पर्म एंटीबॉडी, कि स्पर्म के अगेंस्ट कोई एंटीबॉडीज तो नहीं है इसके अंदर. दैट यू हैव टू सी, एंड इट इज डन अराउंड डे 12 to day 14 of the ovulation. And after how much time of the intercourse? Sexual intercourse के 8 to 10 hours के बाद you have to perform this test. And if you see 10 progressive motile sperms per high power field. High power field ये microscope का high power field है. And in that if you see 10 progressive motile sperm, then this test is considered normal. So you have to remember 3 things in this. Sims-Hanner test is also known as postcoital test. Then why it is done? To detect the anti-sperm antibody. When it is done? Around day 12 to 14 of the ovulation. After how much time you have to collect the cervical mucus? कितने time के बाद collect करनी है? After intercourse 8 to 10 hours. And how many motile sperms will be normal? 10 progressive motile sperm per high power field is considered as normal. इससे कम हुआ तो it is abnormal test. Less than this is abnormal. Then come to the causes of male infertility. So the causes are classified as pre-testicular causes, means testis के पहले के causes. First is genetic cause. तो इसमें क्या आ जाएंगे हमारे 47XXY or Klinefelter syndrome. Chromosomal defect will come or gene defect will come in genetic causes. और there is Y chromosome deletion. Y chromosome का कुछ portion delete हो गया. It is not present. Endocrinal causes include obesity, important cause. Gonadotrophin deficiency, जिसमें आएगा Kallmann syndrome. What is Kallmann syndrome?
Hypogonadotropic hypogonadism.
Very good. So what is happening in Kallmann syndrome is, suppose this is your hypothalamus, ये pituitary stalk है, and this is the pituitary gland, pituitary stalk, and this is the hypothalamus. So there are defective neurons in the hypothalamus, and these defective neurons are of GnRH releasing. The GnRH releasing neurons are defective and olfactory neurons are defective. यहाँ पे दो type के neurons में defect है. In Kallmann syndrome there is defect in 2 type of neurons. पहला है GnRH releasing neuron and second is olfactory neurons. So GnRH releasing neuron से क्या निकलेगा? कम GnRH निकलेगा. The gonadotropin releasing hormone will be less, and इसके बदले में in the contrary what will happen? The pituitary hormones will also be less. There will be less LH and there will be less FSH. LH और FSH जो कि pituitary से निकलता है वो भी कम होंगे. So मेल में कम टेस्टोस्टेरोन होगा and females में estrogen progesterone कम हो जाएंगे. So there will be hypogonadotrophic hypogonadism. Very correctly said. Then olfactory neurons में defect होने की वजह से क्या होगा? There can be hypoanosmia, means decreased smell sensation, or anosmia, that is absent smell sensation. जो person है या तो उसको जो भी smell है बहुत कम आएगी या फिर एकदम भी उसको कोई भी smell नहीं आएगी. So there can be hypoanosmia or anosmia. Then what are the other features of Kallmann syndrome? Why I am telling Kallmann syndrome in detail? Because ये important है बहुत. So मैंने पहले एक ट्रिक बताई थी पिछली क्लास में, किसी को याद है? How to remember Kallmann syndrome?
Anosmic.
Very good. बोलो इसका मतलब क्या है? बस निमोनिक याद कर लिया. Because Kallmann syndrome में anosmia होता है तो हम anosmic word से you will remember. So A for anosmia, N for no menses. Because GnRH is less, LH, FSH is less, so no menses. In case of males, there is oligospermia, less sperm count. S for sexual hormone defect. or deficiency, sex hormone deficiency. M for midline defects. Midline defects like, what are midline defects? Example bolo.
Cleft palate.
Very good, very good. Cleft lip and cleft palate. And I for inherited. How it is inherited? X-linked or autosomal dominant. X-linked or autosomal dominant. And C for cryptorchidism. What is cryptorchidism?
Undescended testes.
Very good. Undescended testes. So this is how you can remember the Kallmann syndrome, the features of Kallmann syndrome. और एक mnemonic है, there is one another mnemonic I am telling you, you can follow either. कोई भी इसमें से follow कर सकते हो. तो Kallmann word से ही याद रखना है. Kallmann. K for remember can't smell. K for can't smell. A for हो जाएगा absent GnRH. L for low testosterone in case of males and low estrogen and progesterone in case of females. L for lack of secondary sexual characters. Lack of secondary sexual characters. M for menstrual abnormalities. Menstrual abnormalities. ये सब नोट कर लो. A for atrophic gonads. The gonads are not responding. Why? Because FSH or LH कम है. So atrophic gonads, that is why इसको बोलते हैं hypogonadism. Hypogonadism. N for normal karyotype. Normal karyotype means the genes are, sorry, your chromosomes are, numbers are okay. Either it is female, so 46XX, or male होगा तो 46XY. The chromosomes are okay. And N for neural migration defect. इसमें कौन से neurons migrate नहीं हो पाए? Which neurons are defective? GnRH and olfactory neurons are defective. So this trick also you can remember. Then thyroid dysfunction can also cause male infertility, hyperprolactinemia. Then psychosexual causes include erectile dysfunction and impotency. And अगर कोई patient anti-hypertensive drugs लेता है या anti-psychotic drugs लेते हैं for anxiety or depression, so they can also cause infertility. Then testicular causes. So testicular causes, first is your Carter-Jenner syndrome. This is also very very important. Carter-Jenner syndrome में क्या होता है? जहाँ पे भी कोई भी सीलिया है बॉडी में, that is lost. ठीक है. So यहाँ पे क्या होगा? क्योंकि sperm में एक ये सीलिया है for motility. So this is absent in the patients of Carter-Jenner syndrome. Only the head of the sperm is present. There is no tail. So there is no motility of the sperm. So that is why the male is infertile. इसमें क्या होगा? जो respiratory tract में जो cilias होते हैं वो भी absent है. So Carter-Jenner syndrome में respiratory infections are also very common. Then cryptorchidism. If the testes are not descended, testis जो है abdomen में ही है, abdominal testis, so there will be no pregnancy to the female partner. Infections like mumps or orchitis. This is very important cause, but especially during puberty, not for the adults. Then toxins inhalation or ingestion. Varicocele. Varicocele means varicose veins of the spermatic cord. And when you will examine, how you will feel? इसको कुछ बोलते हैं, किसी को पता है? This is
Bag of worms.
very good, very good.
Worm of bag.
Bag of worms feeling. Bag of worms feeling if you do the examination of this male patient. So while examining the testes, you will feel a bag of worms is there in case of varicocele. Then another cause is Sertoli cell only syndrome. जिसमें क्या होगा? There is FSH is very high, but the germ cell जहाँ से spermatogenesis हो रहा है, the spermatogonia is absent. It is aplastic or hypoplasia is there. So what is Sertoli cell only syndrome? There will be only Sertoli cells. What is the function of Sertoli cells? Sertoli cells जो है, they help in progression of germ cells to spermatozoa. germ cells को spermatozoa में convert करने में help करते हैं Sertoli cells. लेकिन यहाँ पे क्या है? germ cell layer is absent. In Sertoli cell only syndrome, the germ cell layer is hypoplastic or aplastic and the FSH is very high. That is why there is no pregnancy to the female partner. Then oligoasthenoteratozoospermia. So the last cause in testicular causes is oligoasthenoteratozoospermia. Oligo means the sperm count is less, astheno means the sperm motility is less, and terato means the morphology is not normal. There is abnormal morphology of the sperm. So this is known as oligoasthenoteratozoospermia. Then post-testicular causes. What are the post-testicular causes? Two categories are there: obstruction in vas deferens and other causes. So before going to the post-testicular causes, let us first know the route of the sperms. How do they go? So first is they are in seminiferous tubules. They are in seminiferous tubules. Seminiferous tubules में क्या होता है? Sperms are produced and these seminiferous tubules are in the testes. ये question आता है, that is why I am explaining. So sperms are produced in seminiferous tubules. कौन से cells से produce होते हैं? From the spermatogonia or the germ cells. They are produced from germ cells or the spermatogonia. कहाँ पे produce होते हैं? They are produced in the seminiferous tubules of testes. First point. Second is there is a epididymis. They go to epididymis. But how do they go from seminiferous tubule to epididymis? इसके बीच में एक connection है. That connection is known as rete testis. Rete testis और उसके बाद होता है vasa efferentia. Vasa efferentia. So this is the connection between seminiferous tubules and epididymis. Rete testis, first the sperms go to rete testis and then they go to vasa efferentia and then they go to the second point, that is epididymis. Epididymis में क्या होता है? Very important question. ये एक बार आ चुका है. In epididymis, the sperms they get mature. Sperms they get mature and they gain mobility. So epididymis में 2M है. 2M are there in epididymis. Mobility and maturation. What is the function of epididymis? It provides maturity and mobility to the sperms. Very important. Then they will go to the third landmark, that is vas deferens. इसके बाद कहाँ जाएंगे? तीसरी जगह पे vas deferens. ठीक है? Then they will go to the fourth landmark, that is ejaculatory duct. Ejaculatory duct. Ejaculatory duct में क्या क्या होता है? The vas deferens joins with the duct of seminal vesicle to form the ejaculatory duct. How ejaculatory duct is formed? By the joining of vas deferens and seminal vesicle. By the joining of vas deferens and seminal vesicles. ठीक है? And this ejaculatory duct pass from the prostate gland. It passes from the prostate gland. So suppose this is the ejaculatory duct, तो इसके यहाँ पे ऐसे prostate gland रहता है. It passes through the prostate gland, and then the sperms reach the fifth landmark, that is the urethra. This is the route of sperm. Route of sperm. Seminiferous tubules, epididymis, vas deferens, ejaculatory duct and urethra. Seminiferous tubules and epididymis connection क्या है? Rete testis and vasa efferentia. How is ejaculatory duct formed? By the joining of vasa deferens and seminal vesicle. What is the function of epididymis का function क्या है? Maturity and mobility of the sperms. Where are sperms formed? In the seminiferous tubules. These are the few questions जो यहाँ से आते हैं. Then how you will remember the route of sperm? कैसे याद रखोगे? By the mnemonic 7 up. The mnemonic is 7 up. अब यहाँ पे N का मतलब कुछ नहीं है. N for nothing. So first is seminiferous tubules. Seminiferous tubules. E for epididymis. V for vas deferens. E for ejaculatory duct. N for nothing. U for urethra. And P for penis. This is the route of sperms. 7 up. So now you come to the post-testicular causes. First is obstruction in the vas deferens. Vas deferens में ही obstruction है. So this obstruction can be congenital or it can be acquired or it can be surgical. So congenital में क्या होगा? There is absence of vas deferens. Birth से ही vas deferens is absent. Then Young syndrome. What is Young syndrome? It is epididymal obstruction combined with bronchiectasis. अगर epididymis के obstruction के साथ patient को bronchiectasis है, then it is given a name that is known as Young syndrome. Acquired causes में आएगा TB and gonorrhea. Surgical causes is herniorrhaphy, which is the surgery for hernia repair, and vasectomy. इन दोनों की वजह से भी vas deferens obstruct हो सकता है. Other causes include ejaculatory failure. Ejaculatory duct से ही नहीं निकल पा रहा है semen. Retrograde ejaculation means instead of coming outside, urethra की तरफ आने के बजाय the ejaculation has gone inside the bladder. So उसको urethra से बाहर आना था, so but the semen has gone retrogradely, means instead of coming forward, it has gone backward and drained inside the bladder. This is retrograde ejaculation. And hypospadias. What is hypospadias? It is the presence of urethral opening at the under surface of the urethra. जो urethra की opening है, it should be at the middle. लेकिन वो कहाँ पे? At the under surface of the penis. So it is of 3 types. First is peniscrotal, that is at the junction of scrotum and penis. Media or penile hypospadias at the shaft of penis. And previous or glandular hypospadias, इसमें क्या होगा? The urethral opening is at the glans penis. ठीक है? So these are the types of hypospadias. Hypospadias क्या है? यूरेथ्रा की जो ओपनिंग है वो सेंटर में ना होने के बजाय कहाँ पे होती है? At the under surface of the penis. इसके 3 types है, peniscrotal, penis and glandular. Peniscrotal, the opening is at the junction of testis and penis. Penis or medial location is at the shaft of penis. Previous or glandular, वहाँ पे opening कहाँ पे होगी? At the glans penis. Then what is the basic evaluation of an infertile couple? अगर कोई भी infertile couple हमारे पास आता है, so what are the basic investigations you will suggest? First is history and examination. History taking. Like age पूछना है, what is the menstrual history, whether the cycles are regular or not, amount of bleeding क्या है, whether there is dysmenorrhea, dyspareunia, pelvic pain is there or not, or is there any history of PID, history of genital tuberculosis, history of thyroid disorders, या history of galactoria means increased prolactin is there, so prolactinoma भी हो सकता है. So all these questions you have to ask. Then HSA, husband semen analysis, test for ovulation जो अभी हमने पढ़े थे, that you have to do, test for tubal patency and at least one TVS. Transvaginal sonography at least देना ही है every female who is coming for infertility treatment. So these are the basic investigations you have to suggest. So first is semen analysis. So this is very very important. यहाँ से कोई भी question आ सकता है. Every line is a question. So what is the normal volume of semen? It is 2 ml or more and average is 1.5 ml. pH should be between 7.2 to 7.8. Viscosity. Viscosity means thickness or कितना गाढ़ा है या कितना पतला है सीमेन. So you have to rate it on a scale of 0 to 4. So viscosity should be less than 3. Sperm concentration, it should be 20 million in 1 ml. Average is 15 million per ml. Total sperm count in one ejaculate, it should be 40 million, more than 40 million per ejaculate or 39 million per ejaculate. Motility, at least more than 50% of the sperm should show progressive forward motility. Average can be around 32%. Morphology, normal shape and size के कितने sperms होने चाहिए? At least more than 14%. That is the required, but average is 4%. Viability means living या फिर जिंदा sperms कितने होने चाहिए? 75% or more. Average is 58%. Leukocytes, white blood cells should be less than 1 million in 1 ml. Round cells क्या होते हैं? Non sperm cells, जैसे कि कोई भी इमेच्योर जर्म सेल्स है या WBCs है, वो सब राउंड सेल्स में काउंट होते हैं एंड दे शुड बी लेस देन 5 मिलियन पर ml. स्पर्म एग्लूटिनेशन, स्पर्म आपस में रिएक्ट करके जो एक दूसरे के साथ अटैच हो जाते हैं, दैट शुड बी लेस देन 10%. स्पर्मेटोजोआ शुड डू like this. So these are the normal semen analysis or normal parameters you have to look for the semen analysis. Then this is also very very important, these terminologies. What is normospermia? जितने भी हमने semen analysis में parameters देखे हैं, all are normal, that is known as normospermia. Next is oligozoospermia or oligospermia, means the sperm number is less, sperm count is less than 20 million per ml. Normal कितना होता है? Normal sperm count is more than 40, अभी पढ़ा है, more than 40 million. Then asthenozoospermia or asthenospermia, the sperm motility is less. Teratozoospermia means increased number of abnormal sperms. Oligoasthenoteratozoospermia, it is the combination of these three. Azoospermia, very carefully listen these two terms, azoospermia and aspermia. Azoospermia क्या होता है? No sperm in the semen. Semen is there but there is no sperm in it. Semen तो है लेकिन उसमें sperm नहीं है. Aspermia means no ejaculate. Ejaculatory failure is there. कुछ भी semen निकला ही नहीं. That is known as aspermia. And azoospermia means semen is there but there is no sperm inside the semen. Leukocytospermia means semen में WBCs बहुत ज्यादा है. And necrozoospermia means there are dead or non-viable or non-motile sperms inside the semen. Semen में ये वाले sperm ज्यादा है जिसमें कोई सीलिया नहीं है. So without सीलिया वाले sperms है, non-motile or non-viable means dead. Dead sperms are there. That is necro. Necro means dead. Then what else you will do? एक तो हम semen analysis करेंगे. Next investigation is testicular biopsy. Why you will do testicular biopsy? To differentiate between primary testicular failure from obstruction of the vas. So ये दोनों को differentiate करने के लिए हमें testicular biopsy करनी पड़ेगी. And you have to check the FSH level. Very very important. अगर बहुत ज़्यादा है FSH levels, that means there is testicular failure. FSH level बहुत ज़्यादा क्यों हो रहा है? Testis is not responding to the levels of FSH. इसलिए FSH ज़्यादा है फिर भी testis respond नहीं कर रहे. That is testicular failure. Very low FSH means जो cause है that is lying inside the pituitary or hypothalamus. And if there is normal FSH, that means vas deferens में obstruction है. There is obstruction in the vas deferens. So that completes your infertility. Now come to uterine fibroid, also known as myoma, leiomyoma or fibromyoma. So ये सारे नाम हमें याद रखने हैं. This is the most common benign solid tumor of uterus. It is the most common pelvic tumor in females. एज ग्रुप क्या है? 35 to 45 years में ज्यादा होता है. It affects more the nulliparous female, जिसका एक भी बच्चा नहीं हुआ है, that females are more affected. Composition क्या है? It is made up of muscles and fibrous connective tissue. Then types of uterine fibroid. So extrauterine fibroid भी होते हैं. That is the cervical fibroid is most common. But we are more concerned with the uterine fibroid. यूट्राइन फाइब्रॉइड जो है 3 टाइप के होते हैं, इंट्राम्यूरल और इंटरस्टिशियल फाइब्रॉइड. दे ग्रो इन द मायोमेट्रियल लेयर. दे ग्रो इन द मायोमेट्रियम ऑफ द यूट्रस. देन वी हैव सबम्यूकस फाइब्रॉइड. दे ग्रो इनसाइड द यूट्राइन कैविटी. Then we have subserous fibroid. They grow outside the uterine cavity towards the peritoneum. So interstitial, submucous and subserous. Most common is the interstitial or also known as intramural. This is the most common type of uterine fibroid. Now risk factors include, first is the age of the female. 35 to 45 अगर है तो she is at more risk. Early menarche, nulliparous women or one child infertility. Obesity, PCOS, hyperestrogenic state, बहुत ज्यादा estrogen है body में तब भी fibroids होते हैं. If there is family history and if she is taking more of a fatty diet. Then protective factors क्या है? Late menarche is a protective factor क्योंकि late menarche होगी तो there will be late exposure to estrogen. Estrogen से late में उसका पाला पड़ेगा, तो estrogen late में मिलेगा तो there will be no hyperestrogenic state. इसलिए it is a protective factor. Multiparity, menopause, OCPUs and smoking is a protective factor. और किसके लिए smoking is a protective factor? For which disease?
Ulcerative colitis.
Yes, very good. Ulcerative colitis and endometriosis also. And third is fibroid. Now, patient profile. So, most common nulliparous में होगा, age is 35 to 45. Most common presentation is asymptomatic. Around 75% जो patient है उसमें कोई symptoms नहीं होते. And most common symptom is heavy menstrual bleeding. Heavy menstrual bleeding include menorrhagia और metrorrhagia. Dysmenorrhea हो सकता है, dysperiunia, retention of urine और frequency of urination, बार बार पेशाब जाना पड़ रहा है, recurrent miscarriage और preterm labor. These are the presenting features. Then what are the complications? Very 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 important. So secondary changes इसमें होते हैं. First is degeneration. ये question आता है. Most common degeneration is hyaline degeneration. जो fibroid है उसमें सारा hyaline tissue से replace हो जाता है. So hyaline degeneration is the most common degeneration found in the fibroid. Then cystic degeneration और fatty degeneration किस में मिलते हैं? They are found in postmenopausal women. Very important. Calcific degeneration ये किस में मिलेगी? Important, subserous fibroid में. इसमें क्या होगा, पूरा कैल्शियम डिपॉजिट हो जाएगा फाइब्रॉइड में. द फाइब्रॉइड विल बी कैल्सिफाइड एंड इट विल बिकम हार्ड लाइक अ स्टोन. सो उसको बोलते हैं कैल्सिफिक डिजनरेशन को बोलते हैं वूम्ब स्टोन, और यू कैन से कैल्सिफाइड फाइब्रॉइड इज नोन एज वूम्ब स्टोन. देन नेक्स्ट इज रेड डिजनरेशन. वेरी इंपॉर्टेंट, यहाँ से 2 क्वेश्चन आते हैं. इट इज सीन ड्यूरिंग प्रेगनेंसी, कौन से टाइम पे, ड्यूरिंग सेकेंड ट्राइमेस्टर. एंड हाउ विल बी द फाइब्रॉइड अपियरिंग, लाइक अ रेड बीफ अपियरेंस, एज इफ जैसे कि अभी अभी एक मीट का पोर्शन कट किया है. इट विल बी लाइक दैट, इट विल बी वेरी वेरी रेड like this. So red beefy appearance, it is seen in red degeneration of the fibroid. Then atrophic changes, ये कब होंगे, after menopause. Why? Due to the loss of estrogen. Then necrosis can be there. It is due to lack of blood circulation inside the fibroid. Infection हो सकता है fibroid में, कब होगा, following delivery and abortion. So this is the time when infection can spread inside the fibroid. And कौन से fibroid में infection दिखता है, it is seen in submucous fibroid. Then there can be vascular changes, and least common secondary complication, very very important, it is sarcomatous change, means cancerous change. So sarcomatous change is the least common secondary change, and it is seen in submucous fibroid. So this is very very important, which type of complication is seen in which type of fibroid, when it is seen, ये सब याद रखना है. Then secondary changes को याद रखने के लिए there is a mnemonic. It is avoid red hot fatty meat of chicken. A for atrophy, R for red degeneration, H for hyaline degeneration, which is the most common. At least in 65% cases it is seen. Fatty degeneration or calcification. Meat, that is myxomatous degeneration, ये भी एक type का degeneration है. And C for cystic degeneration. This is how you can remember some of the secondary changes. Then torsion. Torsion किस में होगा? Torsion means ये pedunculated जो होंगे, the fibroids which are having a stalk, pedunculated fibroid. So there is twisting of this peduncle. It will be twisted. So this is known as torsion, and it is seen in subserous pedunculated fibroid. Another complication is inversion of uterus. It is seen in large subserous fibroids. Capsulated hemorrhage can be there, and it can also lead to endometrial cancer. Important. Fibroids are a risk factor or complication. Complication of fibroid leads to which type of cancer? It is endometrial cancer, not cervical cancer. ये याद रखना है. Then investigation, most common used investigation is USG, but most accurate is MRI. Next topic is lesions of the genital tract. So vulva, that is the external genitalia of female, also known as pudendum. Pre-malignant lesions. Pre-malignant lesions, only names you have to remember, rest all you don't have to remember. First is vulval intraepithelial neoplasia. Second is Paget's disease of vulva. इसमें क्या होगा? There will be eczematous rash, slow growing cancer. It is a slow growing pre-malignant cancerous condition जिसमें क्या होगा? There will be eczematous rash over the vulva. Then lichen sclerosis, इसमें क्या होता है? Thin white patchy skin हो जाती है which affects the genital and anal areas. Chronic vulval dystrophy and condyloma acuminata, that is genital warts. Then vulval carcinoma, it is a rare condition. ये क्या थे? Pre-malignant. Now malignancy, it is very rare. Most common अगर मिलेगी, it will be seen in post-menopausal women. Variety of cells will be squamous cell carcinoma, and how it will spread, very very important, it will spread through lymphatic route. Now come to the carcinoma of fallopian tube. This is also a very rare condition, and what is the clinical feature or what is the presenting feature? There will be intermittent profuse watery discharge from the vagina, and this discharge is sometimes foul smelling. Foul smelling, intermittent, profuse watery discharge from the vagina. Then come to the carcinoma of endometrium. So pre-malignant lesions include your simple hyperplasia. There will be the hyperplasia of the cells. Cells जो है अपने number में बढ़ जाएंगे. But without atypia. Without atypia. Without atypia means जो lining है uterus की that will be thick. But the cells will look normal. ठीक है. Cells will look normal, but the uterine lining is very thick. So this is also known as cystic glandular hyperplasia. So simple hyperplasia without atypia. Next is complex hyperplasia without atypia. In the next category, now atypia is coming. Atypical growth is coming. Means uterine lining is abnormally thick with abnormal looking cells are also appearing. So now third is the simple hyperplasia with atypia. Hyperplasia भी हो रहा है और यूट्रस की लाइनिंग भी बढ़ रही है प्लस एबनॉर्मल सेल्स भी इंक्रीज हो रहे हैं. Fourth is complex hyperplasia with atypia. And the last is carcinoma in situ, means the cancerous growth has started, but it is not crossing the basement membrane. This is known as carcinoma in situ. And very, very important is this line, 25% of adenomatous hyperplasia means this type wale. 25% of adenomatous hyperplasia, 50% of atypical hyperplasia, 50% of atypical hyperplasia, these two, and 100% of carcinoma in situ will progress towards malignancy if they will be left untreated. अगर इतने चीज को 25% एडिनोमेटस हाइपरप्लेशिया को 50% एटिपिकल हाइपरप्लेशिया और 100% CIS को अगर हमने अनट्रीटेड छोड़ दिया, it will lead to endometrial cancer. Now come to endometrial cancer. What are the risk factor? Unopposed estrogen therapy. बहुत ज्यादा estrogen है body में. Nulliparous women. Any estrogen dependent cancer in the body. कोई भी एक cancer है body में which is secreting estrogen. Then next is Crocus cancer syndrome. What is this? This is the combination of obesity, diabetes, hypertension along with infertility. This is known as Crocus cancer syndrome. ये भी एक risk factor है for endometrial cancer. Family history of breast cancer, ovarian cancer, colon cancer and endometrial cancer. This is also a risk factor. Now protective factor for endometrial cancer is use of OCP, multiparous women, normal or early menopause, physical exercise and smoking. They are protective factor. Patient profile is postmenopausal women. So सबसे ज़्यादा patient जो endometrial cancer का होगा that will be a postmenopausal woman, usually a nulliparous woman. What are the signs and symptoms? Watery offensive discharge from the vagina. What is the variety? It is adenocarcinoma. Vulval cancer कैसे variety का था? Squamous cell carcinoma. But endometrial cancer is of adenocarcinoma. Spread is lymphatic spread. Metastasis, most common site is lungs. Important question. Most common site is lungs for metastasis. Now come to cancer of cervix or carcinoma cervix. What are the benign conditions? Cervical ectopy or erosion हो गया. Second is cervical eversion or ectropion. बाहर वाली चीज अंदर वाली चीज बाहर आ गई. The inside things are coming outside. And Nabothian cyst. What is Nabothian cyst? It is a mucus filled tiny cyst over the surface of the cervix. And why they are happening? They are formed due to the blockage of the glands by new cells. And why these new cells are blocking the glands? Because of the cervical injury or after birth. So क्या हुआ Nabothian cyst में? ये एक mucus filled sac है. Why this sac has formed? Due to this childbirth टीयर ऑफ द चाइल्ड बर्थ और ड्यू टू एनी अदर सर्वाइकल इंजरी। इसमें क्या हुआ, द ग्लैंड्स आर, सर्वाइकल ग्लैंड्स जो है वो ब्लॉक हो गए बाय द न्यू स्किन सेल्स। नाउ दीज आर द बिनाइन कंडीशन. We are now going to discuss the cancer of cervix. It is the most common cancer of females in India and worldwide अगर पूछेंगे most common cancers affecting females is breast cancer. So female में worldwide सबसे ज्यादा होने वाला cancer is breast cancer. Female में सबसे ज्यादा होने वाला cancer in India is cervical cancer. What are the risk factors? Very important is HPV infection, human papilloma virus. Which strains? 16, 18, 31, 33. Sexual intercourse before the age of 16 years, multiple sexual partners, multiparity, poor personal hygiene, smoking is a risk factor, and OCP use. Very, very important. OCP is a risk factor. लेकिन OCP is a protective factor for endometrial carcinoma. Variety is squamous cell carcinoma. And which staging is used? Just remember the name, FIGO staging. Spread कैसे करेगा? It spreads through the lymphatic route. Patient profile is premenopausal female आएगी हमारे पास and multipara. Endometrial cancer में क्या था? Nullipara. यहाँ पे क्या है? Multiparous female will come. Symptom is abnormal menstruation, post coital bleeding होगी. Just after having a sexual intercourse, she will be bleeding. Offensive vaginal discharge will be there. Investigation क्या करेंगे? Pap smear, which is the screening test. और ये जितनी भी sexually active female है, सबके लिए हमें pap smear करना चाहिए. Then how you will interpret the pap smear? अगर normal है, if the readings of pap smear are normal, repeat after every 3 years. If it is unsatisfactory, repeat at mid cycle. At the mid of the cycle, around 14, 15, 16 day, फिर से एक बार pap smear करना है. अगर results are inflammatory, repeat after 6 weeks. If you find dysplasia, means abnormal cell growth, if it is mild dysplasia, repeat after 6 months. If it is moderate to severe dysplasia, then biopsy should be done. If colposcopy is available, colposcopy क्या है? You will use the vaginal speculum along with the source of light. Vaginal speculum को use करना है along with the source of light, that is colposcopy. Colposcopy अगर available है तो you have to do colposcopy guided biopsy. वहां से tissue निकालना है and you have to do the biopsy. If colposcopy is not available, you have to go for cone biopsy. And if the growth is visible outside, then you have to go for punch biopsy. Very important. For cervical growth visible outside, which biopsy is done? Punch biopsy. Then come to the ovary lesions, lesions of the ovary. Non-neoplastic tumors में क्या आएंगे? Follicular cyst, corpus luteum cyst, theca lutein cyst, granulosa lutein cyst, PCOS. It is the benign tumor of ovary, endometrial cyst. Then neoplastic ovarian tumors or ovarian lesions include epithelial tumor. This is most common. ये क्वेश्चन आता है. Germ cell tumor, sex cord stromal tumor and gonadoblastoma. Now epithelial tumors के कौन-कौन से types हैं? Just remember the names. Serous cyst adenoma or adenocarcinoma. This is the most common type of epithelial tumor. This is the only question asked. यही question यहाँ से पूछते हैं. Mucinous cyst adenoma. This is the largest cyst of ovary and it is a type of epithelial tumor. Endometrioid tumor, mesonephroid or clear cell tumor, Brenner's tumor. Then next was germ cell tumor. इसमें क्या क्या आता है? It includes dysgerminoma, endometrial sinus tumor or yolk sac tumor, embryonal cell carcinoma, polyembryoma or choriocarcinoma, and teratoma. And mature teratoma is known as dermoid cyst. ये क्वेश्चन पूछते हैं. Mature teratoma is known as dermoid cyst. Important question. Teratoma can be immature, also known as monodermal tumor. Then next carcinoma of ovary is Sex cord stromal tumor. It includes granulosa cell tumor, thecoma and fibroma. Next is androblastoma, also known as gonadoblastoma. It includes, इसमें क्या है, Leydig cell tumor, Sertoli cell tumor and Hilus cell tumor. Now this is very important. इसको एकदम by heart करना है. Questions are repeatedly asked from here. Psammoma bodies are seen in squamous cyst adenoma. Hobnail cells are seen in clear cell carcinoma. Wall-hard nest cells, they are seen in Brenner's tumor. Coffee bean cells and Karl-Exner bodies, they are seen in granulosa cell tumor. So कैसे याद करना है इसको? मैंने कैसे याद किया था? Granny means granulosa cell tumor. Call for coffee. Granny call for coffee. Call for Karl-Exner body and coffee bean nuclei. They are seen in Granny means granulosa cell tumor. ऐसे याद कर सकते हो. You can remember like this. Ranki crystals, this is seen in Hilus cell tumor. Schiller dual body, very important. ये पूछते हैं. Yolk sac tumor. They are found in yolk sac tumor. Signet ring cells, very important, seen in Krukenberg's tumor. Krukenberg, this is G. Then different tumor markers, very important. इसमें क्या है? Malignant epithelial tumor के लिए you have to do CA-125. Mucinous cyst adenoma you have to do CEA, carcinoembryonic antigen. Yolk sac tumor, AFP, alpha fetoprotein. Embryonal cell carcinoma, it is diagnosed by HCG and alpha fetoprotein. Choriocarcinoma, beta HCG. Dysgerminoma, LDH and placental ALP. Granulosa cell tumor, it is diagnosed by inhibin. So this slide is also very important. Again, this is also very important. Most commons of ovarian tumors. Functional cyst. Most common functional cyst of ovaries, F for functionals, F for follicular cyst. Most common cystic tumor of ovaries, cystic tumor. So serous cyst adenoma. Largest ovarian tumor is mucinous cyst adenoma. Most common stromal tumor is granulosa cell tumor. Most common germ cell tumor is dermoid cyst. It is also known as, what is the other name of dermoid cyst?
Ma'am, teratoma.
Yes, mature teratoma. Mature teratoma is known as dermoid cyst. Malignant germ cell tumor, most common malignant germ cell tumor is dysgerminoma. Germ cell tumor, germinoma, dysgerminoma. Pure germ cell tumor is also the dysgerminoma. So ये सब एकदम you have to by heart all these things. These three slides should be at the tip of your tongues. This is very important. Now dermoid cyst or mature cystic teratoma or mature teratoma. This is the most common germ cell tumor of the ovary. It is lined by the lining, you should remember, squamous cells or squamous epithelium. And what are the contents? So we were discussing regarding the contents of dermoid cyst. इसके अंदर क्या क्या हो सकता है cyst के अंदर? So it can contain or it can be composed of bone हो सकती है इसके अंदर, teeth हो सकते हैं, hair, sebaceous material और sebaceous fluid, thyroid tissue हो सकता है इसके अंदर, bronchial mucous membrane. So all these can be the contents of dermoid cyst or mature cystic teratoma. Now what is truma overi? Very important. इसमें क्या है? Any teratoma or any germ cell tumor which contain thyroid tissue. अगर dermoid cyst का content thyroid tissue है तो उसका एक special name है जिसको बोलते हैं struma overi. So and struma overi is the ectopic site for hyperthyroidism because it secretes the thyroid hormones. So struma overi is the dermoid cyst which contains thyroid tissue. Next, again very important, Krukenberg tumor. First of all, it is the secondary tumor of ovary. This is the secondary tumor of ovary. That means it has come from some other site. ये कहीं और से आया. कहाँ से आया? That is known as the primary site, and most common primary site is the cancer stomach. So the cancer of stomach has metastasized to the ovary. Cancer of stomach जो है वो उड़ के आ गया ovary के अंदर. So that is why it is the second home. Ovary is the second home for this tumor. So Krukenberg is the secondary tumor of ovary. What is the primary site? Most common primary site is carcinoma of stomach. Second most common primary site can be breast cancer, and rest it can be large bowel cancer. It is usually bilateral. दोनों ovaries को एक साथ affect करता है, and it spreads through lymphatic route, and ovaries they retain their normal shape. The ovary are having this carcinomatous tissue, but still the shape of the ovary is normal. And signet ring cells are found. When you will collect the cells from the ovary, you will find signet ring cells. So very important, signet ring cells are found in Krukenberg's tumor. And another important is it is the secondary tumor of ovary. These two things are very important. Another important is what is the primary site? It is the cancer of stomach. Then what are the symptoms? It is a type of granulosa cell tumor. Before puberty, if it is caused, then it leads to precocious puberty, and if it occurs after puberty, अगर after puberty किसी भी girl को होता है तो it leads to postmenopausal bleeding. What are the treatment? Ovarian tumor, if it is found during pregnancy, if it is uncomplicated, there is no complication, then the surgery should be done between 14 to 18 weeks. That is, in second trimester, the surgical removal of the ovarian tumor should be done. And surgery should never be done after 36 weeks. Very important. And if it is a complicated pregnancy, then irrespective of the gestational period, चाहे कोई भी वीक चल रहा है प्रेगनेंसी का, कोई भी ट्राइमेस्टर चल रहा है, surgery should be done. So irrespective of the gestational age, the surgery should be done in cases of complicated pregnancies. Next topic is disorders of sexual development. First is male pseudohermaphroditism and second is female pseudohermaphroditism. What is male pseudohermaphroditism? Pseudo means false. Pseudo means false. So it is a false male. Only the external genitalia are of male, but the gonads are of female. The gonads are ovary, not the testes. So it is a false male. Male pseudohermaphroditism. External genitalia male and gonads are ovary. Female pseudohermaphroditism means false female. So external genitalia is of female, but the gonads are of male. That is, she is having testes. First condition is adrenogenital syndrome or congenital adrenal hyperplasia. First question from here will be, it is an autosomal recessive condition. Why it is happening? It is happening due to the defect in one enzyme, that is 21 hydroxylase enzyme. और भी बहुत सारे enzymes are defected. There are other enzymes which are defective in this condition, but the most common is 21 hydroxylase enzyme. What is the karyotype? It is female, 46XX. Internal genitalia are of female, but the external genitalia is enlarged clitoris, penile type of urethra, and the labia minora has fused together, which appears like a scrotum. So adrenal hyperplasia means adrenal gland is hyperplaced or it is enlarged. So what it is doing? It is releasing large amount of androgens. Due to these androgens, the external genitalia is appearing like that of male. So it is a female, but due to adrenal hyperplasia or due to large amount of androgens, the external genitalia is looking like that of male. इतना ज्यादा एंड्रोजन से कि एक्सटर्नल जेनिटलिया पूरा मेल जैसा हो गया, लेबिया माइनोरा फ्यूज हो गया, इट हैज बिकम लाइक स्क्रोटम and the clitoris has enlarged. What are the presenting features? Hirsutism and amenorrhea. Unusual pattern of hairs. Hirsutism and amenorrhea will be there. No menses will be there. How you will investigate? You will look for the amount of this enzyme, 21 hydroxylase enzyme, and it will be highly increased. Next is Turner syndrome. Here one X chromosome is absent, 45XO, and it is the commonest chromosomal abnormality in females. Bilateral streak gonads होंगे, means दोनों ही ovaries are not working. Patient reports primary amenorrhea. Ill-developed or absent secondary sexual characters will be there. Height बहुत कम होगी, less than 150 centimeter, and the female genitals, female organs, internal organs, fallopian tube, cervix, and uterus, they will be infantile. They will not grow beyond the infant stage. So they are small in size and they are not doing the proper amount of function. So they are ill functioning and they are infantile also. What is the presentation? Very, very important. 90% of fetuses are aborted during intrauterine life ड्यू टू IUGR और नियोनेटल पीरियड में भी डेथ हो जाती है. आफ्टर बर्थ it will present with cystic hygroma, shield shaped chest, male like chest will be there, coarctation of aorta will be there, and horseshoe kidney will be there. Both the kidneys will be fused. लोअर पोल, दोनों किडनी का लोअर पोल जो है वो आपस में फ्यूज हो जाएगा और ऐसा लगेगा like the horseshoe. This is known as horseshoe kidney. At puberty, if this child survives till puberty, she will complain of primary amenorrhea, absent secondary sexual characters, short height कितनी होती है, less than 150 centimeter, widely spaced nipples, webbed neck. This type of neck is known as webbed neck. Cubitus valgus. What is cubitus valgus? When the arm is extended. So हमारे arms कैसे होते हैं? The forearm is in a straight line with the arm. आर्म जैसे होगी सीधी वैसे ही हमारी फोर आर्म भी सीधी होती है. बट इन केस ऑफ क्यूबिटस वल्गस द फोर आर्म इज गोइंग बियॉन्ड द एंगल. इट इज नॉट गोइंग स्ट्रेट. द फोर आर्म इसकी टेढ़ी है, आर्म सीधी है, आर्म इज स्ट्रेट, but forearm is going outside the angle. And there will be short fourth metacarpal. There will be micrognathia. The jaw will be undersized. छोटा jaw होता है इसका. Maxilla is undersized. In adulthood, what she will come with? She will be associated with autoimmune disorders. So she can be associated with certain autoimmune disorders like Hashimoto thyroiditis or Addison's disease. Then hypertension हो सकता है उसको, diabetes, colon cancer, osteoporosis. But very, very important, the intelligence will be normal. So there will be no decrease of IQ. The intelligence is normal. Investigation करेंगे तो estrogen is low, but FSH and LH is high. Then next is Klinefelter syndrome. Here there is extra X chromosome. So this is 47XXY. So due to the presence of extra X chromosome, क्या हुआ है? Testes are small, firm and abdominally placed. There is undescended testes or intra-abdominal testes. External there is male appearance, but genitalia is small and infantile. There will be gynecomastia, enlarged breast in case of male. Infertility will be there. Why? Due to oligozoospermia. What is oligozoospermia?
Less sperm count.
How much less? Very good.
Less than 20 million.
Very good. Less than 20 million per ml. Voice is high pitched. Psychological abnormalities होंगी इसको. वेरस टर्नर सिंड्रोम में क्या था, इंटेलिजेंस वाज नॉर्मल। यहाँ पे साइकोलॉजिकल प्रॉब्लम्स है लाइक एंजाइटी एंड डिप्रेशन होंगे, मूड स्विंग्स होते हैं, सीरम टेस्टोस्टेरोन लेवल इज लो। Next is androgen insensitivity syndrome. This is a X-linked recessive disorder, very important. Karyotype is 46XY. Gonads are testes. Male है और gonads are testes. So it is a male baby. Grows tall. Normal breast development है but rears like a girl. ठीक है, मेल है बट रहता है लड़कियों के जैसे। Why it is happening? Due to the X-linked recessive disorder. There is no uterus और primary amenorrhea के साथ आएगा. Short vagina is there because androgen है body में but insensitive. Androgen insensitivity syndrome. So testes grow नहीं हुए and there is a short vagina is there. Phenotypically and psychologically he is a female. Absent and scanty axillary or pubic hair. Investigation करेंगे तो testosterone level is normal but LH level is very high. What is the management? Management is as soon as you diagnose this condition, the testis should be removed. Why? Because it has a high potential for malignancy. ये question एक बार AIPZ में आ चुका है या किसी स्टेट पीएससी में आया, मुझे याद नहीं है, बट इसका ट्रीटमेंट पूछा गया था एक बार। द ट्रीटमेंट शुड बी एज सून एज एंड्रोजन insensitivity is diagnosed, the removal of testis should be done, or at least at puberty the removal of testis should be done. Why? Because it has a high potential for malignancy. Then next topic is amenorrhea. What are the types of amenorrhea? Physiological and pathological. Physiological में primary and secondary. Primary is before puberty, there is no menses, so that is physiological amenorrhea. Secondary amenorrhea में pregnancy, lactation and after menopause also there are no menses. So they are secondary physiological means normal amenorrhea. Pathological में primary and secondary. Primary is क्रिप्टोमेनोरिया, हिडन मेंसेस। कौन से कंडीशन में होता है क्रिप्टोमेनोरिया? इज ड्यू टू
Septate vagina.
मोस्ट कॉमन कॉज इज imperforate hymen. Imperforate hymen. So we will discuss all this. First is cryptomenorrhea. It is the occurrence of menstrual symptom but there is no external bleeding. Why? Because menstrual blood fails to come outside the genital tract because there is some obstruction. So there are congenital causes और acquired causes भी हैं. Congenital में most common is as I have told imperforate hymen और अभी जो किसने बोला septate vagina, that is the second cause or the other cause, transverse vaginal septum. But most common you have to remember that is imperforate hymen. Acquired causes में cervical stenosis हो गया, किसकी वजह से? ड्यू टू amputation of cervix, cauterization of cervix or conization of the cervix. Then true primary amenorrhea, it is the failure to menstruate beyond the age of 16 years. इसमें क्या होंगे? Compartment wise the causes are listed here. So compartment 1 is where there is outflow tract obstruction or there is obstruction in the uterus, like your Mullerian anomalies or androgen insensitivity syndrome, जिसको क्या बोलते हैं? टेस्टिकुलर फेमिनाइजेशन सिंड्रोम भी बोलते हैं. So androgen insensitivity is also known as testicular feminization syndrome. Compartment 2 में आएंगे disorders related to the ovary like gonadal dysgenesis and which includes your Turner syndrome and pure gonadal dysgenesis. Gonadal dysgenesis जो है वो दो टाइप का है, pure gonadal dysgenesis and mixed gonadal dysgenesis. Gonadal dysgenesis is of two types, pure gonadal and mixed gonadal dysgenesis. प्योर गोनाडल में क्या है? क्रोमोसोम्स आर ओके 46XX. इसमें क्या है? मोज़ैक पैटर्न है 45XO, इसलिए एग्जाम्पल में है टर्नर सिंड्रोम. Here there are bilateral streak gonads. Bilateral streak gonads. इसमें क्या है? One streak ovary or one immature ovary, and one is your testes. One gonad is testes. Okay, so this is the difference. Next is agar if the causes are hidden in the pituitary gland, there is some neoplasia or tumor inside the pituitary gland. And fourth compartment is disorders of CNS, like we have already discussed the Kalman syndrome, or there is adrenal hypoplasia. So these are the causes of the CNS. Next is secondary amenorrhea. What is secondary amenorrhea? You have to remember the criteria. So, this is absence of menstruation for 6 months or more in a woman with previous normal menstrual pattern. She was previously menstruating normally, but there is absence of menses now for more than 6 months, for 6 months or more, and there is no pregnancy also. ठीक है, सो पहले जो है शी वॉज मेंस्ट्रुएटिंग प्रॉपरली, बट नाउ अभी 6 महीने से उसके मेंसेस बंद हो गए और प्रेग्नेंट भी नहीं है. दिस इज नोन एज सेकेंडरी एमिनोरिया. और फीमेल्स विथ साइकिल्स 9 cycles, less than 9 cycles per year, this is also a criteria for secondary amenorrhea. एक साल में 12 साइकिल होने चाहिए, 12 cycles should be there in a year, but she is having less than 9 cycles in a year. Now these are the causes. All these causes ये हमने भी पढ़ लिया. So just go through these causes. If you have any doubt, you can ask me. Now some other important causes of secondary amenorrhea are: first is pregnancy, but this is a physiological cause. Most common cause of secondary amenorrhea is pregnancy, but it is a physiological cause. Then hypothyroidism should be ruled out in every case. So in every case of amenorrhea, कौन सा टेस्ट हम लोग देंगे? You will advise a thyroid profile. You will advise a thyroid profile. Then hyperprolactinemia, diabetes, tuberculosis, renal disease or liver disease, Addison's disease, Cushing syndrome, acromegaly, all these endocrinal causes you have to rule out. कोई ड्रग्स तो नहीं ले रही है फीमेल. Malabsorption syndrome and AIDS, these all are a potent cause for secondary amenorrhea. Next and very important and very burning issue in this society today is PCOS, polycystic ovarian syndrome, also known as Steen-Leventhan syndrome. दूसरा नाम याद रखना है because इसी नाम से क्वेश्चन आता है. Steen-Leventhal syndrome, also known as PCOS. It is characterized by amenorrhea, means absence of menses, hirsutism, male-like pattern of hair growth. Virilization, what is virilization? Clitoromegaly, enlargement of the clitoris. Acne, oily skin, male-like body pattern. This is virilization. Hypertrichosis, non-sexual hair, also known as lunago hair. Obesity and enlarged polycystic ovaries. These are the features of PCOS. Other features include increasing obesity, especially the belly fat, menstrual abnormalities such as amenorrhea और oligomenorrhea. या तो absent है menses या फिर होते तो बहुत टाइम बाद होते हैं, 40 after 40 days. Then hirsutism. Hirsutism is unusual facial hair growth, male pattern type of facial hair growth. And इसके लिए एक scoring use होती है. Just remember the name of the score. It is modified Ferryman-Gallwey score. This is used for grading hirsutism. इसमें क्या करते हैं? 9 sites are seen for hirsutism. 9 sites पे हम लोग देखते हैं hair growth. If the score maximum score क्या है? 36. And if the score is more than 8, that means mild hirsutism. If the score is more than 15, it is severe hirsutism. Then other features of PCOS is infertility, acne, acanthosis nigricans, very important. इसमें क्या होगा? There is hyperpigmented velvety patches on the skin folds. especially around the neck and axilla. Below breast and thighs में भी हो सकता है. Next is Heron syndrome. What is Heron syndrome? It is hyperandrogen. HA means hyperandrogen. Insulin resistance. AN means acanthosis nigricans. Androgens will increase. Insulin resistance हो जाएगा body में, and there will be this type of skin pigmentation, acanthosis nigricans. This is known as Heron syndrome, seen in case of PCOS. What are the investigations you will suggest? The FSH will be low and LH will be high. LH is to FSH ratio will be more than 3 is to 1 or more than 2 is to 1. Very, very important. FSH low, LH high. Very important. ये याद रखना. High estrogen, androgen, progesterone, prolactin, and insulin. All these will be high. Progesterone and FSH will be low. So remember low. Low only two are there, FSH and progesterone only are low. Rest all are high. Then regarding the LDL and HDL. HDL will be low. Good cholesterol is low and bad cholesterol is high. LDL is high. Lipoproteins, low density lipoprotein is high. High density low protein is lipoprotein is low. Then if you will do transvaginal sonography, very very important. You will see pearl on string appearance. Pearl on string. एक string के ऊपर ऐसे मोती सजा हुए हैं. This is known as pearl on string appearance. So you can see here. What are these? These are the ovaries enlarged in volumes, and these are having large number of follicles arranged in the periphery. This is the enlarged ovary, and they are having follicles arranged at the periphery. How many follicles? More than 10 to 12. This is diagnostic of PCOS. More than 10 to 12 follicles is diagnostic of PCOS. So that's all for today, and here we finish the gynae portion and today's class also. अगर किसी को कुछ doubt है, just go through this lecture and notes once again. If still you have any doubt, then you can freely ask me. Okay, we'll end the session here. Good night and all the best. Study